Excellent evening, everyone. Excellent evening to every one of us. Well, highly welcome to this evening's broadcast. Welcome, welcome. Happy New Week, Happy New Week, Happy New Week. How are we doing? I hope we're great. I hope you're enjoying your day. And remember, if it doesn't make you smile, change it, okay? We're all highly welcome to this evening's broadcast. Welcome, welcome to every one of us. If you've joined me live, you can greet. So I can welcome you to this evening's broadcast and Happy New Week. Today, like we advertised, we're going to be looking at osteoarthritis, okay? We'll look at natural remedies, some home remedies for osteoarthritis. We'll look at the causes of osteoarthritis. We look at some of the symptoms of osteoarthritis. We look at some of the natural remedies, some of the home remedies, okay, that you can have. So you're all welcome, welcome, welcome. If you've joined me live, you can greet. So I can welcome you to this evening's broadcast as we look at natural remedies for osteoarthritis, okay. All right, welcome, welcome, welcome. So let's share. Let's share out to friends so that they can help us. Have you come in contact with someone who is limping of recent? This is the time to show love and share out to that person. Have you also come in contact with someone who is complaining about cold causing some kinds of pains here and there? It's time to share love, okay? So just share out to your family members, share out to your colleagues, share out to elderly people around you, share out to your friends, share out to the groups where you belong. You can also paste it on your story, okay? Because just in 24 hours, it's also out of there. By then, you would have touched lives with it. You can also repost for me. Welcome, welcome, welcome. If you join me live, you can greet. So I can welcome you to this evening's broadcast as we look at natural remedies for osteoarthritis. Okay, I'm almost finishing the sharing and then we'll go ahead and have a good time enlightening ourselves and making sure that we do the needful after that. So we are all highly welcome. Thank you for joining me. Thank you for joining me. Okay, so we just get going. I want to be fast today. But of course, you know, you can always ask your questions if you have any question. Let me be sure I'm hearing myself. Okay, yeah. So if you have any question, you can ask. Hello, Alayinka Shofowora. You're welcome. Welcome to this evening's broadcast. Thank you for joining me. God bless you, okay? So we're talking about osteoarthritis today, and osteoarthritis is the most common form of arthritis, and it affects millions of people worldwide. So you're not alone. And you know, it occurs when the protective cartilage that cushions the ends of your bones wears down over time, okay? So usually it's called an arthritis of wear and tear, that, you know, it's a gradual degree of your joints wearing out, okay? So although osteoarthritis can damage any joint, it can actually damage any joint, the disorder mostly affects the joints in your hands, your fingers, your hands, your knees, your hips, and your spine. Some weeks back, we dealt with spondylosis. Spondylosis is an osteoarthritis of the spine, whether it's cervical spondylosis, thoracic spondylosis, or lumbar spondylosis, whichever one, that's what it is, okay? So osteoarthritis symptoms can usually also be managed because it's usually a wear and tear, you know, disease, okay? And although if you have any damaged joint, it might hardly be reversed, except maybe you do some operation to add some kind of things to it, but it can be managed. It can be managed, very well managed, okay? If you stay active, if you maintain a healthy weight, and if you do the natural things you're supposed to do, like the remedies or some foods and things like that, it will also slow down the progression of the disease and also improve your pains and also your joint functions. These are some of the things that can help you. So osteoarthritis, like I say, occur when the cartilage that cushions the ends of your bones in your joints gradually deteriorates, okay? So, you know, the cartilage is a firm, slippery tissue that enables nearly, you know, frictionless joint movement. It's in, if you get a chicken, for you to know what I mean by cartilage, if you get a chicken, you know that tough part that is usually in between the joint. Like if you want to take the laps of the chicken and you want to cut it off, you see that tough part. That's the cartilage. So eventually, if the cartilage wears down completely, your bone will now begin to rub bone to bone. So osteoarthritis has often been referred to as a wear and tear disease. But besides the breakdown of the cartilage, osteoarthritis also affects the entire joint. It causes change in the bone and the deterioration of the connective tissues that hold the joints together and also attach the muscle to the bone. Okay, so it causes inflammation in that joint lining. Now, there are so many factors that can affect one and increase your risk of getting osteoarthritis. So we just look at maybe like 6 of them. The first one is old age. Remember, it's a wear and tear disease. So because it's a wear and tear disease, then old age is one of the risk factors. Hello, welcome, Grace. Grace, you're welcome. Grace Tudofia, you're welcome. Good evening. Welcome, Ozamaka Stella. Good evening. You're welcome to this evening's broadcast. We're looking at osteoarthritis, the natural remedies, causes, symptoms, and some lifestyle changes that you can do. So I say old age is it. That's one of the risk factors. So if old age is one of the risk factors, no wonder it affects millions of people worldwide. So as you're getting old, you need to do something about it. Welcome, Give Jonathan. Good evening. Happy New Month. It's true, Happy New Month. I've already sent out my Happy New Month greetings to every one of us on WhatsApp and on Facebook. Okay, so Happy New Month. Thank you for reminding me. I ought to have said that. Yeah, now that we are seeing face to face on Facebook. All right, so Olori Olubimi, you're welcome. Welcome to this evening's broadcast. The second risk factor is sex, gender. Women are more likely to develop osteoarthritis than men. Okay, so that's the gender. Then obesity is one of the biggest culprits. Okay, overweight and obesity. When you're carrying extra body weight, it will contribute to osteoarthritis in several ways. The more you weigh, the greater your risk. Increased weight adds stress to the weight-bearing joints, such as your hips, your knees. Also, fat tissue. You know, when you are overweight, you have a lot of fat. So those fat tissue produces proteins that can cause harmful inflammation in and around your joints. So that's why obesity and overweight is one of the greatest risks for osteoarthritis. Then another risk is joint injuries. Injuries such as those that occur when you're playing sports or from home accident or any form of accident can increase the risk of osteoarthritis. Even injuries that occurred many years ago and they seem to have, you know, gone or healed, they are also a risk factor for osteoarthritis. Then another risk factor is repeated stress on the joint. Okay, if your job is a sport, you know, if your job or a sport that you do places repetitive stress on your joint, a particular joint, then that joint might eventually develop osteoarthritis. So that's why prevention, like I say, is better, cheaper, and safer than cure. So if you know you are affected by any of the risk factors I've mentioned, then you need to do something about it. Like genetics also, some people inherit the tendency to develop osteoarthritis. So for example, if you have people in your lineage who are having osteoarthritis, mother, grandmother, aunties here and there, then you need to be careful about it. Hello, Emanuela. You're welcome. Excellent evening. You're welcome to this evening's broadcast. Today we're looking at osteoarthritis, remedies, symptoms, causes, and natural solutions to it. Hello, Abba, you're welcome. Welcome to this evening's broadcast. Okay, now another risk factor is bone deformities. You know, some people are born with some kinds of deformed joints, okay, or malfunctioning joints or defective cartilage. If one has that, then it's also a risk factor for osteoarthritis. And again, finally today, I want to talk about another risk factor, which is metabolic disease, okay? Some metabolic diseases like diabetes, you know, can actually also have be a risk factor for osteoarthritis, okay? And this diabetes and other metabolic conditions in which your body has too much iron, it can actually be a risk factor for osteoarthritis. Hello, Esther Wilson, how are you? welcome to this evening's broadcast. God bless you, ma'am. Grace, all the way from Abuja. Esther is in Uganda. We're all highly welcome. You can tell me where you're calling in from, so that when I see you next, I'll be able to say, oh, you're calling in from here. Thank you. All right, so I've told you about the causes, the risk factor. Okay, so some other things that could actually be a risk factor or cause osteoarthritis for you would be cold. They have cold arthritis, okay? If you're in a cold region and you're not keeping warm and you're allowing your joints to go through some kind of cold, it could also cause arthritis for you, or also be a risk factor or increase it, okay? Of course, we all know symptoms include pains, inflammation, difficulty in movement. You're not able to move your arms and move, your joints in the 360 degree that you're supposed to move it. Okay, so those are some of the symptoms. Now I want to spend time on remedies. Let's not talk too much, because anybody that has osteoarthritis, you already know you have it, so there's no need talking so much about what is the causes, symptoms and the rest, but we've used some time to deal with them. So let's look at some home remedies for osteoarthritis, some things you can do at home that can help you. The first one is hot and cold compress, okay? When it comes to pain, hot and cold compress may be very, very beneficial for you, okay? They don't really cause the long-time side effect that some medication and pain relief medicines would cause for you. Now, hot compresses are very helpful when you have joint stiffness. So when you do hot compresses, it will help to allow better blood flow and then remove the stiffness. And then cold compresses are also best for joint pains, okay? The heat in hot compress will help soothe the stiff joints and relax your muscle, while the cold will help numb sharp pains and reduce inflammation. So, and that's why sometimes when people have such pains, we talk about one having hot and cold compress together. I have an evil visitor on the page today. Please, everybody, don't mind this. I don't know whom that person is, but it's going ahead and sending account number Ayomide Oyeyemi. Please stop that. It's not right for you to bump into somebody's house and begin to do things that are not right. So whoever you are, I'm going to report you now, and it's very best for you to get out of here, okay? All right. So I'm going to do a report now of her. Why is Facebook giving a lot of... Anyway, but we should just don't mind her. You can actually go ahead and delete. Let me report this. All right, I've blocked her, so we can go ahead with what we're doing. I'll just delete all her comments later when I have time, which is when my staff can come online and delete her. I've blocked her, so she's not able to harass any other person. So everybody, mind Ayomide Oyeyemi, so we shouldn't take her serious. She has come in here to put some things. They are just stupid people who don't know their rights and what they're supposed to do. I'll go ahead and delete it. I think when I enter as myself, I'll be able to delete all the comments from there. Let me see. All right. Okay, so I was saying hot and cold compress could help. So compresses can actually reduce muscle pain or spasm, surrounding the joints. Making a compress can also be as simple as using warm water and warm hot towel and cold hot towel, or you can use ice block. Okay, so the second home remedy is Epsom salt. Okay, Epsom salt can actually help you. Epsom salt bath can provide that all over relief, especially for joint pains. Okay, the magnesium in Epsom salt will help the inflammation and the pain. Okay, also studies also reveal that soaking in an Epsom salt bath for a prolonged time may also increase your magnesium level. Okay, so you can actually buy Epsom salt from some of the pharmacies that you have, and then use like 3 cups of Epsom salt in a hot water bath and soak yourself for like 30 minutes. That will also help you. Then another thing that could help is topical. Hello, Deborah James. You're welcome. Welcome to this evening's broadcast, Deborah. How are you doing? I hope you're doing great. Welcome to this evening's broadcast. Thank you for joining me. So topical ointment is the next thing, or cream, that can help if you're having osteoarthritis and pains like that. Okay, so topical ointment can actually help you. I want to delete this guy's messages. Disturbing me here. Now, wow. And I was just seeing it and I'm like, let me finish what I'm saying before I come and see who is all this. She has already sent to too many people. All right, so when we talk about ointment, if you have good ointment for pain, it will help. I have one I always travel with, is aloe heat lotion. Okay, aloe heat lotion is a lubricating lotion that is very well designed for soothing and relaxing massage. Okay, it has a deep penetrating power that will help to soothe your muscle, even if it's after sports or workout, or if you're having pains. Okay, it has a very, very good deep heating agent that will make it very, very ideal for you if you're having osteoarthritis. It can go 7 skin deep. The heat lotion can go 7 deep heat. Okay, you can apply it directly on the affected where you're having the joint pains. You can apply it directly, and it will also be a good work well for all the areas of your skin, and it's very, very good for your knee, for your waist, absolutely well. I always travel with my aloe heat, and what I also do is I rub it ahead of time. Like if I'm going to have a very, very stressful day, I will use the aloe heat on it, and it will help. Hello, Olayinka, how are you? Caroline, how are you? Eno, Dominic, and Divine, welcome to this evening's broadcast. Today we are looking at Patricia. Love day. Good evening. Oh, you're calling in from Lagos. You're welcome. So today we are looking at osteoarthritis symptoms, risk factors, causes, and natural remedies. So we are looking at home remedies now. We've already talked about 3 home remedies. Number 1 is hot and cold compress. Number 2 is Epsom salt. Number 3 is topical ointment that can actually help you. Okay, if you also want to produce your home ointment, you can do capsaicin, and you can do capsaicin with chilies, hot chilies. Okay, and then we also have MSM gel. MSM gel is also very, very good for people who are having arthritis and osteoarthritis. Then another means is to use support device. Okay, there are various types of assistive devices that can offer added support without the need of medication, especially if you're beginning to have osteoarthritis. Hello, Sarah. Immediately I saw love, I looked to say, I know Sarah must be here with me. Thank you. All the loves are coming in, all the types. I accept all of them. Sarah is all the way from Italy. God bless you. From how is Italy, Sarah? I hope Italy is well. Okay, so the exact device that of your choice will depend on the affected joints. Okay, you have braces. Sometimes I also wear braces. I have the braces for my hand when I know I need to carry a lot of things, or I've carried a lot of things, I'm beginning to have some pain. I'll use braces. You can use cane. You can also use knee tapping, shoe inserts, and things like that. Okay, and some people who are having serious arthritis, you can also have, like if we talk about cane, walking stick. If you are afraid to use it outside, use it inside the house. At least it can help you for the period of time you're walking inside the house. Another home remedy is green tea. Green tea contains polyphenols, okay? And researchers suggest that these compounds will also help in lowering inflammation and which is also part of the thing that causes arthritis for you. They did a small study to use green tea in treating new osteoarthritis, and they showed that the tea can actually help with joint function. But there is a risk if you take too much of green tea, it can cause liver problem, okay? That's the side effect of green tea. So you need to be careful to make sure that you're taking it in the required quantity. Ginger is another home remedy. Thank you, Sarah. Okay, you can ask your questions now as we go ahead. Ginger is the next remedy. Oral ginger is also noted for reducing pains from osteoarthritis, okay? They did some studies taking ginger long time, and they found out that it helped to decrease the risk of osteoarthritis related disabilities, okay? So due to the risk and side effects of ginger also, it's also good for you to take it in the recommended quantity. Some people, it causes nausea for them, and some people it also causes some kind of heart stomach issues for them, okay? Stomach upset, diarrhea, heartburn can come from ginger, so you need to be very, very careful. And then also, if you're taking some kind of medications like blood thinning medicine, then you need to be careful about the quantity of ginger you're using. The seventh home remedy is turmeric and curcumin, okay? Curcumin is that active compound in turmeric, and it's part of the ginger family, but it also helps in osteoarthritis in different ways. They did a study in 2016 and found out that curcumin will help, you know, to slow the progression of osteoarthritis and also help with relieving the pain. So if you want to try turmeric as a natural and home remedy, it's also recommended that you take the curcumin extract. The whole turmeric sometimes is contaminated with lead, so it's good for you to also be careful what you're taking. Okay, so let's go through some lifestyle changes. Hello Caroline, you said, how can I get good knee braces? You have to Google and find out. Sometimes you need to try or ask people. There's this one I found. I've not really found a comfortable knee braces that I can use at normal life, but there's one my daughter had that I took from her that was very, very good. But I know I found a wrist one that is also very good for me. So knee braces is something you do trial and error, except if you have someone who has used a very good one, then you can ask the person. I usually don't I've not really used knee braces, like I said, for long. Most of the ones I bought, there's one issue with them, somehow or the other. All right, Divine says, how can you use ginger and turmeric for arthritis? You have to use it in moderation. Like I said, your body weight, one has to check your body weight, check how much your digestive system can take it, can tolerate it. So there are so many factors. Some people also even go ahead to get a dietitian to check all that for them, okay? But I have a supplement that contains ginger and turmeric in the right quantity that can help you, and that's a forever move. So I don't go ahead, I just take my normal ginger in my food, turmeric in my food, that quantity. But I know that if you're having serious issues with arthritis, forever move has both turmeric and ginger, and then it has also eggshell neem in it, so it's very, very good for you. This is what I know, and it's fantastic for arthritis. I've used it for people for years, and there are so many testimonies about it. So if you're still having, your pain is not terrible and it's not prolonged, if you just take this, it's going to handle it. And then you can go about taking your turmeric in every food, or ginger in every food, maybe like a little, like as spices, okay? You know, spices, you don't put so much of spices in the food you're taking, okay? All right, so lifestyle changes. Let's go through some kind of lifestyle changes that you need for more long-term relief. in osteoarthritis, lifestyle changes are often very, very effective. So it's not about, you know, that's why when I tell people, if you're having issues with arthritis and you take my formula, which is Active HA and Forever Move, after taking these two, I expect you, as you're taking them and the pains are off, once you take this, I tell you, within 5 to 7 working days, you will be surprised at what is happening to you. Then I expect you that as you start it, you begin some of these lifestyle changes we're talking about, so that you have a long-term relief and even reverse the arthritis. Okay, there are so many people who have used this, who have followed the formula and the lifestyle changes that I've talked about, and they are no more having all these pains from osteoarthritis. Like regular exercise, healthy diet, weight maintenance, we help improve your joint function. And over time, the muscle will stabilize your joints, and then we strengthen and protect against the damages that actually comes from them. Okay, all right. So the first lifestyle change would be for you to stay active. Exercise can be difficult with painful joints, I agree, but staying active can reduce pain in a long run. Okay, and it will even strengthen your muscles and prevent further joint damage. On Saturday, I showed us some stretches that you can do if you're having back pain. Okay, go ahead and do those stretches and inculcate them into your regular routine exercises. Actually, the Arthritis Foundation says that exercise is the most effective non-drug treatment for reducing pain and improving movement in people who have osteoarthritis. And again, the best type of exercises for osteoarthritis will be slight resistance, improve flexibility, offer like an aerobic, exercise, low impact aerobic exercises, like if you're someone who is already used to biking, swimming, stretches, walking. Walking is very, very good. And then if you go on my page in Aging with Grace, you can also type exercises for arthritis. You will see some of the soft exercises that I've talked there. Okay, and then also Arthritis Foundation recommends 150 minutes of aerobic exercise every week at a moderate intensity, or 75 minutes at a very high intensity. But if you're having serious pain, of course you're not able to do the high intensity exercise, so you can actually start with shorter periods of exercises and then add up time as you go ahead to have them more. Sorry, excuse me. After taking the water, I started saying, like, for example, if I'm talking about starting gradually, you can start with 10 minutes walk, and then you increase the speed and the length of your walk. Okay, and then you can actually add up some new exercises. So that's how to move. Then the second lifestyle change would be eating osteoarthritis friendly food. You need to take thank you for the thumbs up, thank you for the love, I appreciate. You need to take osteoarthritis friendly food. Eating a balanced diet can actually help you to feel better, I'm telling you, and also to lose weight. Remember, I told you that weight gain, overweight, obesity is one of the biggest or highest, or I don't know, culprits to osteoarthritis. Researchers showed that certain foods are especially beneficial for osteoarthritis, especially Mediterranean diets. Okay, if you consume a lot of Mediterranean diet, it will help you to avoid foods that will worsen your symptoms. So go and work on your diet. Add up a lot of vegetables, broccoli, spinach, lettuce, kale, cabbage, ugu, tete, ewedu. Okay, they are all high in vitamin K. And they also have anti-inflammatory properties. Okay, actually, the Arthritis Foundation also says that while the evidence is not completely conclusive, consuming dairy products with calcium and vitamin D can also promote joint and bone health, especially if you're taking plant-based calcium products. Okay, all right. Again, also Good foods will also include nuts, plant-based oil like olive oil, avocado oil, very very good for you, okay? And then omega-3 fatty acids like we have active C omega-3, very good for you. Tuna, salmon, mackerel, they are very very good for you, okay? But also note that there are some foods that will make the osteoarthritis symptoms worse, and you need to avoid those food like alcohol, okay, artificial sweeteners, salt, saturated and trans fats, omega-6 fatty acids, sugar, refined carbohydrates like white bread, pasta, rice, gluten can also increase the risk and the pain of osteoarthritis. Then the third thing, or the third lifestyle change, would be to maintain a moderate weight. You need to maintain a moderate weight. Hello Lubimi, good evening. Welcome to this evening's broadcast. We're looking at natural remedies for osteoarthritis, symptoms, causes. We have looked at them. We have also looked at some home remedies, and now we are looking at lifestyle changes. The first lifestyle change we talked about is for you to be active. The second one is balanced diet, and we are now on the third one, which is maintaining a moderate weight, okay? Actually, according to the Arthritis Foundation, weight loss can go a long way to alleviate your joint pains and prevent osteoarthritis. So maintaining a moderate weight can help keep excessive pressure away from your joints, as well as also helping you to reduce, inflammation. Especially for people who have symptoms on their knees, their hips, okay? If you have pains, inflammation, stiffness in all these places I've mentioned, then you need to reduce weight. Overweight will make those arthritis pain more, so you need to reduce that weight. Weight loss definitely will help you to prevent osteoarthritis, will help you to reduce the symptoms, will help you to reduce the pain. Hello Margaret, you're welcome. Abiodun, Janet, you're welcome to this evening's broadcast. Thank you for joining me. We are looking at osteoarthritis symptoms, remedies, and natural lifestyles that you can use. Now, if you reduce weight, it will ease the pressure on your joints, like your knees and your hip. So the less extra weight you have to carry, the less wear and tear on your body. Look at it, just losing like 3 to 4 kg or 10 kg for people who are very much overweight will reduce the pressure on your knees as you walk. Okay, so, and it will also lower the level of proteins that are causing the swelling. Fat cells create proteins that cause swelling throughout your whole body, and that can damage your joints. So weight loss will actually help you to lose extra fat and also ease that swelling from the proteins we are talking about. And even your joints that are carrying that weight will have less work to do. So there are plenty benefits of weight loss. It can actually be very very dramatic. Usually when I give people my set of supplements for osteoarthritis, immediately they take it for 5-7 days and they are not having effect. I will ask them, how is your weight? And sometimes you ask people about your weight and they don't tell you the truth about it. But I tell you, weight is one of the biggest culprits. If you want to reduce arthritis pain, try to lose weight and you will see how much good you will do to yourself, okay? It will just help. As you're losing that weight, as you're removing that weight, you will find out that the pains are reducing gradually and even in a fast way. All right? Okay, I hope I've greeted Abiodun, Margaret, Iyabo, and Caroline. You're all highly welcome to this evening broadcast. So let me just end up by talking about this weight, because for most of us, it's menopausal weight that is making us get this arthritis and not get out of the pains that we're having from this arthritis. So you need to make a plan. There is no secret formula for weight loss. When you have osteoarthritis, it's all about more physical activity, healthier diet, reducing the calories that are going in and increasing the calories that are going out, okay? So I recommend that you have a plan. You have to have your goal, and then you have to have your plan. You need a structured plan that you can follow, okay? And I'm here to help you. Okay, we talk about how much weight you want to lose. We talk about your present weight. We talk about your goal, and we talk about what you need to do about them. Then you may also need some kind of therapy, okay? Like I've already talked about it. If you're having pain, it's not good for you to stay with pain for a long time. So you need to do something about the pain so that that pain will begin to go. So we have so many products, which I'm not going to talk about today, that can help you if you're having weight. If you're having menopausal weight, these supplements can help you. Chat me on my WhatsApp number +234 703 515 1642, and I talk about them with you there, okay? Because it's a plan, it's a one-on-one thing, it's not a general thing that one. But I'm going to run through some general issues about the losing weight and making sure those you're not giving your knees and your joints so much weight to carry. So my WhatsApp number is +234 703 515 1642. +234 703 515 515. My cousin's refusing to me. +234 703 515 1642. Okay. All right. So that's my number. You can chat me. So we talk about what will work for you. Okay. So we talk about what will work for you. Hello, Mabel, Ene, you're welcome. Welcome to this evening's broadcast, and welcome Chioma to this evening's broadcast. All right. So then you also need a dietitian or a diet that you can go through, and that's also some of the things I plan with you when you chat me on my WhatsApp number. We talk about the therapy, how much is the pain, how is your other vitals, and then we talk about what you're supposed to do immediately to reduce the pain, and then we talk about and discuss some of the things you will get to make sure that you're losing your weight immediately. So in a few talk and meetings and you getting your supplement, you'll be on your way to a better health. Then you need to set a goal. How much weight do you want to lose? And I recommend that if you're having osteoarthritis and you overweight, you start with like 10% of your weight, okay? If you're weighing 80 kilograms and you're having osteoarthritis, you can decide to lose 8 kilograms, okay? You start, if you now lose the 8 kilograms, you check and see how much results you have gotten, and then you now know the next step to take about it. But one thing is to get started, and getting started is just pressing that number +234 703 515 1642 and chatting me. That's how you get started, okay? There is no ideal osteoarthritis weight loss plan for everyone. You have to find what works for you, and finding what works for you is what we talk about, the food you find around you and what you can do about them, okay? And we'll go through some of the tips that you need. Just chat me now, +234 703 515 1642. The fourth thing for you to do is to keep a food diary. Write down everything you eat for a week, for example, before you can now decide, oh, this and this is what I'm going to remove, this and this is what is causing my issues. You remove all those inflammatory foods that you're taking and add more anti-inflammatory and antioxidant food, and this is what we do with you, okay? So you need to look at what you're eating and find out what works better for you. And then the fifth thing or the sixth thing is to start with easy changes to your food, okay? It's if you want to make a very big and let me say a goal that is not smart, changes that are so big, so large to your diet, to your lifestyle, you might not be able to achieve it. You need to start little by little, okay? You start with easy changes. For example, if you are someone who needs to lose weight and you have been taking a lot of food in the night, you can decide to reduce from eating 9 p.m. to 8 p.m. Do you understand? That's a little change. Or you're someone who is taking food that you know is anti-inflammatory, saturated fat and trans fat. You can decide to just remove trans fat this week or this month. So every food you're eating, you check the label and make sure you remove that, okay? So you need to start gradually. That's how to start. You don't start with, oh, I'm going to move everything from my fridge, I'm going to move this one away, and then you now find out that you're still craving for those things, okay? So you need to start with easy changes to the foods that you eat. Then the next thing is to look. There is no miracle diet. Stop looking up and down for any miracle diet. There is nothing like miracle diet, okay? there is no way. Your best bet is a typical healthy diet with lots of vegetables, okay, and some fruits and also whole grains. So you can include these healthy foods in your diet and healthy fats. Decide to do away with saturated fat or oil that is not good for you. Change your oil, for example. You can decide by starting, like I said, little. Go and buy avocado oil, buy olive oil, and remove all this other oil. You can start from there, little by little, okay? And then you now decide, okay, I'm going to remove some of this fatty protein that I'm taking, and you stick to some kind of fish that is omega-3 fish for yourself, mackerel, trout, or salmon. You can start with that. And then you also need to cut down on processed food. Okay, so little by little, week by week, you're removing these things and you're seeing your progress. That's how to go about it. Then again, you need to choose exercises that is not so hard for your joints. Okay, everyone is different. You need to avoid activities that involve running, jumping, that will put stress on your joints. Osteoarthritis friendly activities, like I said before, would include walking, cycling, swimming, fitness ball exercises, okay? These are some of the things you need to make sure you do to help yourself. All right. Hello, Chidibo. You're welcome. Welcome to this evening's broadcast. Though each person may experience osteoarthritis differently, you will commonly have joint pains, like I've said, stiffness in your hands, your knees, your hip, your neck, your lower back. All right. So these are some of the common symptoms. But for you individually, if you need to make sure you improve yourself, the first thing I always tell people, let me just tell you the 4 basic things you need to do. The first thing is to reduce and stop the pain as fast as possible with a natural solution or supplement that can help you immediately. And I have one super one, which is your Forever Move and your Active HA, okay? That's the first thing you need to do to reduce that pain, so that you will be in the right mind and frame of mind to be able to go through the process of having those lifestyle changes that can help you. Then the second thing you need to do is to add in activities, okay? You add up some activities and then you begin to look at your weight. And I've already told you for weight, you need to chat me. We have fantastic supplements that can help you if you want to maintain weight, if you want to reduce and cut off some fats that you already have and remove some craving, and if you want higher metabolism. All these are here that can help you. So that's number 2, okay, that I've talked about. Then number 3, make sure that you start small. Don't take a big chunk of what you are not able to do. All right, it's osteoarthritis can be reversed. You can stay away from all those injuries, from all those hurts, from all those pains, from all those sore, if you do the right thing. All right, so I'll just check and see if I have any question. If no questions, then we call it a day today. And I want to really say thank you to every one of us that joined us today during today's broadcast. On Wednesday, we are going to be looking at simple tea that you can make. Somebody has asked the question about turmeric and ginger tea. So join me on Wednesday, and we're going to be looking at some of these spices and teas that you can make. I'll just show you some quantities that you can add for your food. Okay, I'll answer that question very, very fully, practically on Wednesday. So join me as we make the osteoarthritis tea. Thank you all for joining me, and I think I've greeted everyone. If you did not watch Saturday, please go and watch it to do those stretches. It actually will help for better blood flow for those people who are having back pains, and help you fantastically to stay away from some of this osteoarthritis we are talking about. Thank you all for joining me today. Love you all. See you on Wednesday. Bye.